First on our list is the human papillomavirus, or HPV. This happens to be the most common sexually transmitted infection and can lead to unsightly genital warts and various cancers, including cervical, anal, penile, and throat cancers. But there's good news. Vaccines like Gardasil and Cervarix can protect against HPV. Typically administered in 2 or 3 doses, these vaccines are recommended for both males and females starting at a young age, usually around 11 or 12, to provide protection before exposure to the virus. Next up is hepatitis B, a viral infection that can be transmitted through sexual contact and can cause liver damage, liver cancer, and other serious health problems. The hepatitis B vaccine, administered as a series of 3 or 4 doses, is a highly effective way to prevent this infection. It is recommended for all infants as well as adults who are at risk of exposure to the virus, including those who are sexually active. We also have hepatitis A. While primarily transmitted through contaminated food and water, it can also be passed on through sexual activity, particularly oral anal contact. The hepatitis A vaccine is recommended for individuals at risk of infection, including travelers to certain regions with high rates of hepatitis A and men who have sex with men. Then, there's the herpes zoster virus, which causes shingles. Although not traditionally considered an STI, it can be transmitted through sexual contact. Adults over the age of 50 are recommended to get the shingles vaccine, such as Shingrix, to prevent shingles and its complications, including post-herpetic neuralgia. Last but certainly not least, we have HIV. As of now, there is no vaccine for HIV, but research and clinical trials are ongoing to develop one. In the meantime, preventive measures for individuals at risk of HIV infection include pre-exposure prophylaxis, or PrEP, and post-exposure prophylaxis, or PE. Vaccination against these STIs can significantly reduce the risk of transmission and protect individuals from potentially serious health consequences. It's paramount to consult with a healthcare provider to determine the appropriate vaccination schedule based on individual risk factors and health status. And remember, even if you've been vaccinated against STIs, practicing safe sex, including condom use, remains vitally important. That's a wrap for today's topic on STIs and their corresponding vaccines. Stay informed, stay safe, and until next time, take care.